Hi everyone, welcome to this episode of Aesthetics and Wellness. Today I have Francesca Ogerman-White on the podcast. She is the beauty editor of the Spa Guide at Tatler and the Beauty and Surgery Guide, and CEO and founder of the Beauty Triangle. Today we've talked about the power of aesthetics. We've talked about non-surgical and surgical treatments. We've talked about trends, the psychology behind having treatments and the impact of these treatments on our health, our well-being, but also the importance of partnering with the right practitioner and collaborating across all specialties so that you can really get the best possible outcomes for yourselves. Hope you enjoy, and if you have any questions, please don't hesitate to get in touch. Thanks. So, Francesca White, editor-at-large of the Beauty and Surgery Guide at Tatler, founder, CEO of the Beauty Triangle, mother of one, all-round superstar. I am so delighted to have you on the podcast today.
Oh, Yusra, that is the nicest introduction I think I've ever had. What a delightful way to start the podcast. Thank you for having me.
It's such a pleasure. Thank you for coming all the way. I'm so excited to have you, and I feel like I could keep you all day talking about aesthetics, trends, how you juggle it all. But I want to start off with asking you the question that everyone wants to know is, how did you get into doing all this, into beauty? Because you are a wealth of knowledge and experience in the field. I want to know how you started off in doing all this.
It's an interesting question, and I think it's quite an interesting journey. When I was much younger, I wanted to go into fashion. I spent many years studying fashion, initially design, and that sort of eventually evolved into fashion journalism. I went to St. Martin's and I studied the most fascinating degree called criticism, curation and communication. Ooh. And I essentially learned how to be a curator. So I spent my days and my weeks trawling around London's museums and galleries and really understanding how visitors to those spaces interact with the content in front of them, paintings, drawings, sculptures, whatever it might be. And I find that really interesting because my next foray was into the world of newspapers. Mm-hmm. I worked at the Financial Times, I worked at the Sunday Times Style, all sort of little placements that I did during my university days. And it's very similar, actually, when you think about what a curator does in a gallery to actually what editors do with magazines. We're constantly looking for stories. We're looking how we balance the content. You want to run a really sort of big, in-depth, beautiful feature alongside something short and snappy and fun and newsworthy. And I think you're constantly thinking about how people are engaging with your content and how can you best bring a story to life for them. So I ended up going into magazines. I stayed at Tatler. In fact, I'm still there. It was my first ever job. And I think I've been there now for 13 years, I want to say. And I'm now health and beauty editor at large. But once upon a time, I was the beauty director there, managing the main beauty pages. Alongside that, I was doing the Spa Guide, I was doing the Cosmetic Surgery Guide, and those are now my two domains within the Tatler sphere. So that curation has continued, it's followed through. And a couple of years ago, I set up the Beauty Triangle, which is my really exciting sort of passion project. It's all about aesthetics and wellness. It's bringing it together, making a safe space for conversations. We host monthly panel discussions, and it all accumulated in the Beauty Triangle Festival, which you were an amazing part of in January this year.
It was amazing. I mean, congratulations to you. Well done. You just manage everything so well, don't you?
Oh, that's very kind of you to say. I always have that analogy of the swan in my head. I think above the surface, trying to appear serene, and then frantically paddling below the water.
I think I know. I think I know exactly.
I think you might be one of those as well.
Running around like a headless chicken, but on top we're like, yes, everything's fine.
Yeah, exactly. It's the only way. It's all about optics, isn't it?
So the health and beauty editor at large part of your life is really exploring everything that's going on in aesthetics, what's new, what's not new. I'm sure over the last 13 years, you've seen trends come and go, you've seen things shift. I want to ask you, because it must be quite a challenge actually to navigate the noise in the industry.
Definitely.
Do you think, obviously what you do at Tatler is very different to tabloid news, but what I find is bad news makes news. And that isn't really how it is in Tatler, for example. Good news makes good news, right?
Yeah.
How do you balance that? How do you choose what to put into Tatler when you're doing your guides?
I think first and foremost, you have to think about who the Tatler reader is. I think a successful magazine, a successful brand to that end will always have a very clear idea of who their end consumer is. And we're very fortunate at Tatler. It's the longest standing magazine in the world. Yeah. It was formulated in the coffee houses of St. James's as essentially like a gossip magazine for the elite sort of London society. And it's that DNA within the magazine that carries through. And I think after 13 years, you have a gut feel for whether something is the right fit, whether your readers are going to be excited by it, engaged with it. But I think you really have to stay true to that commonality and sort of just think, is this something that the Tatler reader is interested in? Like, how do they spend their days? What do they spend their income on? What excites them? And sort of really make sure that you hone in on that when you're presenting your content. And that sort of is applicable across the board, whether we're writing about the latest aesthetic trends, but equally, what spa they might want to go to, where they might take their children on holiday that year, what's the latest restaurant opening they might want to visit, what are they wearing this season? Yeah. So it really informs the entire narrative of how the reader lives their life, I think.
So then you're always aware of the psychology of the consumer.
I knew you'd pick up on psychology. Yeah, it's literally, that's your DNA, the psychology, exactly.
Yeah, I mean, I think it drives everything, right? It drives motivation, it drives patient motivation, it drives why they're coming into clinic.
And it's about sort of humans at the end of the day. I think as soon as you engage with human beings, whether we're talking about injectables, whether we're talking about I don't know, the trends that are coming out of our industry, as soon as you make it applicable to other human beings, that's where it gets fascinating, because we all identify. And if it's not personally, it's with other people. Yeah. And it also enables us to better understand other people. Yeah. And so I think it's really, really sort of rich when you sort of boil down into the psychology of who your reader is, for you, who your patient is, for example.
Yeah, absolutely. Yeah, I've been around doing what I do, injectables, aesthetics, wellness now for over a decade, 13 years, almost 14 years now.
That's amazing. Same time that I've been at Tatler. Look
at us. Exactly. And in that time, I've seen a lot of trends come and go. And now I think it's actually noisier than it ever has been. I mean, you hear about Russian lips, you hear about lemon bottle, you hear about fox eye thread lifts. And it's really important that I am always aware of the sphere of influence my patients are exposed to, because that's going to impact their knowledge base, also how they feel about themselves, what they feel that they should tap into, and then motivates them to come into clinic.
And you also want to know what the trends are that are in the social psyche that are being discussed, so that you can have an opinion on them as well, so that you're not caught off guard if somebody comes in and says, I want this Barbie doll XYZ, and you're like, whoa, what is this thing? Yeah, exactly. It's sort of sometimes speaking the same language as the patient. And much like an editor, that's really important, you know, to speak the language that everyone else commonly is.
Yeah, and safeguarding them. Yeah. For me as a healthcare practitioner, I always look at the science behind the new latest fad, because I've seen trends come and I've seen them go. I've seen fads come and I've seen them go. And I'm interested in the ones that are here to stay, and also that have a high safety profile, a low risk profile. Because I've been around for as long as I have, I know that the treatments that I'm going to do today, I will see the impact of that in 10 years' time.
Yeah, exactly.
And so I've got a responsibility before I take needle to face, that I know how it's not just going to act in their face in the short term, but also in the long term.
Exactly. You have a duty of care to everyone who sits in front of you, whether they're following a trend or they're there for sort of general maintenance, rejuvenation.
Yeah. And I think it comes down to that real, for me, scientific evidence to safeguard them, because they will come and say, can I have Russian lips, or can I have lemon bottle? And I've got to be the scientifically knowledgeable skinfluencer, really, amongst the noise of the next door TikTok influencer who's saying put coconut oil on your face, and explains to them why actually that might not be a good idea and how that can negatively impact them.
You're so right. I think the resources, and this is very fundamental to why we set up the Beauty Triangle in the first place, but the resources that we have to get information from nowadays are massive. And a lot of information out there is misinformation. And not all people who profess to be experts necessarily are. Yeah. So I think it's your duty almost as a really credible practitioner that when you have a patient in your care and in your room with you having a consultation, that you really help them get to grips with what is going on out there.
Absolutely. I mean, it's vital, right? Because it can be so confusing for them. How do they know what's right, what's wrong, what's safe, what's not safe? It's hard enough, really, as a medical practitioner, to go through everything and look at the scientific data and evaluate.
Yeah, but massively so.
So it's really, really vital that we have that knowledge base and are safeguarding them. And also that we create a safe space to have these discussions. Yeah. Because that I think is really important. And I think we also have to really acknowledge that there's still a stigma in our society. Often when my patients are coming to seek treatment, they're apologetic. They say to me, I want to have this done, but I'm sorry, I sound vain. And I'm like, no. This is not vain. And I think our industry is thankfully, finally undergoing a seismic shift. We are moving away from being an industry focused on vanity alone to being an industry focused on wellness. And what, I threw myself during the lockdown, into a huge research project that culminated in releasing a report called Beautified Britain Index, the skin report.
Yeah, this sounds fascinating.
It was really, really, it started off as just like this little passion project on the side and ended up being 30-page dossier on what's going on, what are people searching.
Lockdown did that to people, didn't it?
Yeah,
these sort of overnight sort of hobbies turned into lifelong sort of projects.
Literally, I mean, it was like trying to survive homeschooling, and like trying to renovate the house when B&Q was closed. So that was my thing, and what I found was really interesting, and of course trends will change year on year, and we'll talk about that, but. At the time, what I found was, and we looked at everything, news reports, Google Trends, what people were searching on TikTok, what they were searching on Instagram. And there was a huge shift away from this overfilled look towards this concept of skinimalism, wearing your skin rather than wearing a bunch of makeup, removing some of your fillers. So for the first time, I was around when the Kylie Jenner and Kim Kardashian trend started, where they had lip filler and suddenly everyone came in wanting lip filler.
Yeah.
And there's nothing wrong with that if it suits the patient. But actually, if we're going to be distorting the anatomy, that's a conversation that needs to be discussed with the patient. And so we were seeing lots of patients coming in asking for dissolving their lips. We were also seeing now that people were talking about tapping into treatments to help their mental health. So 70% of patients who said that they had a treatment after the pandemic said it improved their health, their mental health, their self-esteem, their psychological well-being. 1 in 4 patients said that they would have toxin treatment. And it became much of the norm. A tweakment became almost self-care, whereas before it was viewed more as vanity.
Absolutely. And I think that data is even still not quite representative of how powerful aesthetics can be to all of us. I mean, I might not say I have toxin and filler to improve my mental health, but fundamentally I feel better when I look better. And I think that is applicable for most men and women in the world. So I think, looking at mental health as a sort of generic term, actually aesthetics plays a massive role in that. And actually, you mentioned something really interesting earlier when you said a lot of women, maybe men as well, are apologetic when they come into you and they see you for aesthetic treatment. They say, sorry if I sound vain. And I think, we have to be very aware of the psychology of even the words that we attach meaning to when we have these conversations. I said something the other day to a colleague. It was when I went on holiday with my family and spending time with sort of children whilst we were away. And
giraffes, I saw.
There were many giraffes in Kenya as well. That was a particular highlight. And we sort of spent a lot of time with our son Felix, but there were times where I said, I felt a bit sort of guilty that I sort of, sometimes let him go off and play in the kids club or whatever it was. And my colleague said, no, you mustn't feel like that. This is self-love. This isn't you being selfish. This is no guilt. This is self-love. You have to also sometimes prioritize your needs because we run around doing 1,000,001 things. And I've heard this conversation from many patients, colleagues, family members, friends who I know who have been considering cosmetic surgery, maybe a tummy tuck after they've had a number of children, maybe a facelift in later life. And often they feel, again, that sense of guilt and that sense of, I shouldn't be doing this. This is vanity. It's a waste of money. I should be doing other things with my time, with my finances. I think, we really have to look after ourselves and our well-being. It's why they say put your oxygen mask on first, right? Before you apply anyone else's.
I was just about to say that. You took the words out of my mouth. As a mother of 3 and as a clinic owner with 2 clinics, one in London, Harley Street, one in Liverpool, and teaching and educating and looking after my therapists and my doctors and my patients. It's huge responsibility. And what I find, and often, Sophie's here today. Sophie actually stops me. She's like the gatekeeper and she goes, you have to say no. You've really got to, I talk about the power of no, lean in on the power of no. And essentially what it is saying yes to me, saying yes to my time, taking back my power. And so when I see patients coming in for aesthetic treatments and they say to me, I feel really embarrassed or I'm really apologetic. They're really sorry about it. It's almost like sorry to themselves and sorry to the world. And And I get it. I get that mom guilt and it never really goes away. But actually, I explained to them, self-love is vital because you need to show up as the best of you, not just giving the world the rest of you.
100%.
And you can't do that. You can't pour from an empty cup. You've got to fill that cup back up in order to keep giving.
And it's funny, I think you almost have to go through that to realize it. I definitely spent the first year of having Felix, my son, prioritizing him as every new mother does. Yeah. Probably, my skincare regime slipped. I probably wasn't doing all the treatments. I probably wasn't eating properly. Yeah. His welfare was top of my list of priorities. Yeah. Mine slipped right to the bottom. Yeah. And that's not uncommon.
Did that make you feel resentful?
It didn't make me feel resentful, but I felt silly because I work in this industry. I spend my days telling people the importance of looking after themselves, prioritizing themselves, doing all of these things, little adjustments here and there, keeping yourself running at your optimal. Yeah. And I felt foolish that I was the one not listening to my own advice, not taking my own advice. And so actually, at the start of this year, I was like, right, okay, that things do need to change a little bit. And sort of getting away, having sort of 2 weeks out of the hamster wheel of London life and work and whatnot was part of that. But I think it's just that general awareness, stop, wait, before I do that, before I reply to that email, before I take that extra meeting that I don't really have time for, before I say yes to that extra invitation, what could I be doing for myself as well?
Yes, good, well done. That's
an epiphany. It's not a massive one, but it's a powerful one.
It's a very, very powerful one, actually, because also there's a reason why we call it R&R, rest and rejuvenation. You're rejuvenating your soul, your mind, and you come back feeling a lot better. Burnout is a whole other conversation. I can talk about burnout because I've almost felt it myself. I've seen it amongst a lot of my colleagues, and it's dangerous and it takes a long time to recover from. So as soon as I start to see signs of it, I'm like, right, I need to book a holiday. Yeah. I need to go. And that's
it's
what
actually
I need
about
to
your
do.
mental health. And I even said this to my husband when we were planning a trip recently. And, it wasn't the most ideal time of year. There was a lot going on. And I actually said to him, this isn't about going on a fancy 5-star holiday and being flashy. This is genuinely about mental health. Yeah. And this is about doing something at this stage of our life when we need it most to really reboot ourselves. And also, I'm sure you'll agree, but you go away, you travel, you gain a different perspective. I think it's very important as a business owner, as somebody with their own brand, who has to be creative, who has to be business-minded, to have that headspace as well. It's incredibly important just to be able to see the wood for the trees sometimes.
Yeah, get your creative mind on.
Yeah, otherwise all you're seeing every day is just constant emails coming in and you're sort of running around like a headless chicken and being a busy fool, I suppose. And you need that perspective.
Yeah, I was talking to my sister about this the other day, about the executive mind and the creative minds. We are often in our executive mind making decisions on high adrenaline, high cortisol, because we're in the go, get things done mode. And that doesn't leave space for the creative mode. So I actually love being on a train between London and Liverpool. That's my creative space. I'm looking out the window. I'm thinking about the next thing. I'm thinking about how I'm going to approach problems, how I'm going to solve things, what I'm going to do next. And it's such a wonderful space to be in. It's my time to really think creatively.
That's so interesting. So I spent my train journey from London to Liverpool on my emails and, writing proposals and, sort of filing sort of whatnot. But actually my place, my creative space is on a massage bed, which sounds very appropriate for somebody that might edit a spa guide.
So you don't fall asleep. You're
also, you're not allowed your phone when you're having a massage, technically speaking. And I know as soon as I can have my phone within sort of an arm's reach, then it's game over for me. But actually, that's when the cogs start turning. I feel like we've massively gravitated away from trends, though. Although I suppose this is probably a trend in itself, a better understanding of patient psychology.
Yeah, and self-care. I think self-care. Understanding that actually does come down to self-care.
I mean, I think we saw self-care emerge as a trend in lockdown, but I think this is an evolution. This is almost like self-care 2.0.
Yes,
because I think the self-care that we spoke about in lockdown was very much like, okay, we don't have access to these treatments and we can't go and have our nails done. We can't have what are we doing at home instead? How are we doing at home facials? What are the active ingredients we're using, rightly or wrongly? That didn't always go to plan for some skins, and there was a lot of disruption, sadly, as a result. But I feel like this is it's self-care in terms of what can we do sort of physically, but also mentally.
I agree. I think some of the trends that I saw from the Beautify Britain Index, the skin report that I threw myself into, was skincare actually, and the rise of the educated consumer. And I think that is continuing. That is something that has certainly shifted over the last decade.
I hear it over and over whenever we host events. We invite consumers in our Beauty Triangle community, and the feedback is always, my goodness, consumers today, your consumers they are incredibly educated when it comes to skincare. Almost doctors sit in front of them and they're like, I have nothing left to say to you. You know a lot.
But sometimes I always say, Sheikh Google is not the best place to get information from. Again, bad news makes news. And it can be a really difficult place to navigate. And TikTok, Instagram, there's lots of people out there giving advice that sometimes even isn't scientifically backed. And so
I'm preying on people who are somewhat vulnerable. I think a lot of the people who get very, very into their skincare knowledge, information, who really search around the web for answers, are people who are often struggling with their skin. Obviously, it might be an inflammatory condition, it might be acne. I've been one of those people, had breakouts, as every beauty editor does, when you're trying 3,000 moisturizers in the course of a week, and you break out. But I think actually you have to be so mindful of the person who is consuming this information. They are in a state where they are desperately looking for solutions. And that's when, sadly, errors in judgment, obviously not to their understanding, are even made in the first place.
I've been that person. I am an acne-prone patient. Oh, by the way, I'm skin. If anyone's watching this and they can see half my face falling off, it's not a contagious skin condition. It's yet another skin peel.
You totally rock it, though.
I embrace it. I was saying yesterday at the Tatler event, people were saying to me, "Do you have croissant hanging off your face?" And I'm like, no, that's skin.
But your skin is remarkably glowy at the same time, despite the peeling. So it's definitely doing something. This is the perfect peel, right? You said to me.
The perfect peel. I love peels. I have them at least 3 times a year, and I think they really help. I love a peel.
I need to get back in and have a peel. Have I done a peel in the last year? No, of course I've not. I'm going to go and book a peel at the end of this.
There we go. That's it done. So I think that certainly I've seen over the last few years the rise in the educated consumer, but they're not always fully educated. So they come and they go, "Oh yeah, I'm using retinol because the next TikTok influencer said to use that. I'm using azelaic acid. I'm using 10% niacinamide." They're ingredients driven, but they don't know how to put their skincare packages or products together.
Absolutely.
They don't realize sometimes their skincare can be making inflammation worse. They don't understand the concept of delivery systems. They don't understand the strengths can make a difference. I have a lot of patients who come in buying the ordinary 10% niacinamide. Because they were told niacinamide is great, but actually we know that 5% is optimal and 10% can go the other way. So they're educated, but they're not medical practitioners. And that's why they come to us to help, again, filter out that noise, explain to them how best to use their products. So that's a huge trend. And skincare, even in skincare and male grooming, is huge. There was an increase in 50% in the pandemic, increase in 50% of patients Googling skincare. So people are starting to realize the power of skincare. Also, they couldn't get in for their skin peels or their microneedling or the treatments. So skincare is something that they could do.
I think it definitely sort of creeps in at a certain stage of life as well. I think when we are in our sort of adolescent years, maybe even early 20s, and, generally speaking, we might have pretty good skin. And these things don't bother us so much. As soon as we start to notice the open pores, we start to notice a little bit of fine lines creeping and maybe a bit of pigmentation, suddenly we're like, skincare. This is why everyone's been banging on about skincare all this time and I need to get on it.
I think further to that is Zoom boom. Over the course of lockdown, people were locked at home. They couldn't get out. They couldn't communicate with their friends. They couldn't do their work except via online platforms, Teams, Zoom, FaceTime, whatever. That's how they remained connected. And for the first time ever, they started to see a reflection of their faces, not just at rest, but dynamically. They started to notice how their face moved when they were speaking, smiling, frowning. And they thought, oh my God, I've got lines and wrinkles there. I've got an asymmetry. Or my skin is not glowing.
Or even just in bad light. I think halfway through lockdown, we all cottoned onto the beauty of a ring light and the importance of having a natural source of light, a window in front of your laptop, for example. But before people started talking about that, we were all sat there in the shadows. And obviously poor lighting, as every person who has been in front or behind a camera knows, is the difference between an amazing image of you and a completely awful one. So I think suddenly, whether it's actually there or not, we're picking up on these things that we're thinking, oh my God, that wasn't there before. Why suddenly is this the case? Has lockdown aged me? What's it done to me?
Totally. And there was a whole plethora of new Google terms being looked at, like pandemic droop, because people were stressed, right? Stress results in frowning and headaches and high cortisol, and that has an impact on your skin health, on inflammation in the skin. Again, they started to Google mental health and skin. Skin anxiety was a thing as well. These things all started to come out after the pandemic. And then as soon as restrictions were lifted, we did have a Zoom boom. People were coming in and accessing treatment unapologetically because they realized the impact it had on them.
I think when you can't have something, that's when you realize your dependence on it.
Yeah, exactly. You realize how much you loved it.
Yeah.
And also the impact it makes. And now I see people moving towards, I think there is certainly another shift, and skincare is still there, and I think it will continue to grow. I think people are accessing skincare a lot younger. So we've got the younger generation accessing it now, which is a double-edged sword, and that's something that we can talk about. And I think now, you've recently just come back from the Galderma trends.
Yeah, at
called
MCAS.
Next. Yes. Tell me about that. So now there's a whole new shift in trends and future of what we're going to see.
Yeah, exactly. So I was one of a number of people invited to Miami back in September 23 with Galderma, and we spent 2 days in a series of hotel rooms, which were very immersive and exciting and creative, discussing what the trends of the future might look like in aesthetics. And collaboratively, we identified 6 trends. Let me see if I can remember them all off the top of my head now. There was mindful aesthetics. There was beauty fandom. There was proactive aging.
Was that cancelling age?
There was cancelling age, yes. There was fleeting aesthetics, and there was expressionality.
Okay.
And they were all fascinating in their own way. And essentially we had groups of plastic surgeons, we had dermatologists, we had aesthetic doctors, practitioners, and we had press and journalists and other sort of skin influencers all weigh in on what these trends meant to them, what the future looked like with them. And it really opened my eyes, because I think when we talk about trends, we have to be very mindful that discussing a trend doesn't mean it's something that we're advocating. Again, it's looking at society, and it's a commentary on the narrative that is running through the fabric of our society.
Yeah.
And I mean, for example, there was one that came up that was called beauty fandom. And this was so divisive, especially for the UK market. So everyone who was from the UK, like myself, we sat there and we watched these little TikTok videos and reels, and we saw teenagers, adolescents who were reshaping their ears to look like elves and fairies. And we saw girls who were going and asking for Barbie noses and actively sculpting this very artificial looking profile to their face. And we were all completely horrified, and we were like, this is the worst trend ever. We absolutely cannot be advocating this. Is this the way that the industry is going? Is this what our children are going to be exposed to? And actually what was really interesting was actually the commentary from Galderma saying, nobody's advocating this. This is merely looking at what a subculture in society is exposed to. Look at the pop culture that's around at the moment. Look at how we're all engaging with social media. Barbie was, in the cinemas at that time. There was a huge emphasis on AI. There still is. There's a huge sort of drive to, I suppose, sort of fantasy and these sort of fantastical creatures that people are sometimes identifying with or exploring. And I think it was just really, really mind-blowing to think there are people, and they might not be my Tatler readers, for example, they might not be my beauty triangle community, but there are certainly people out there who are embracing aesthetics in a very different way to how I always talk about it. Not everybody is looking at toxin filler, biostimulators, peels, whatever it might be, skincare, to make them look like the best version of themselves. Who are we to decide who is the best version of any of us? It's completely in the eye of the beholder.
Yeah.
So there was some really, really insightful and divisive conversations that came out of that.
I can really imagine that. And I think it's almost like a balance between you do you, and I respect your autonomy, and it's vital to be aware of it, because again, we have to be cognizant of our patient's sphere of influence. This is what they're exposed to, and they will be influenced by that. Yep. And so where do we fit into that? And it's okay.
And your ethical responsibility as a practitioner sometimes to say, let's just look at the facial anatomy. Let's look at how these trends, these treatments are going to evolve with time. Let's look at how your facial anatomy is going to evolve with time. How will this Barbie nose look in 10, 15 years, sort of down the line, once you've kept doing it and kept doing it and kept doing it. I think also what that trend does is it really shines a light on the importance of understanding patient psychology again, and making sure, are you asking for this for all the right reasons? Is this definitely something that has been driven by a positive element in your life, in your psyche, or is this coming from a less positive place? So again, I found it's the one trend that really stuck with me from that, and not because it's something that I aspire to or advocate, but because I think that more than anything shows what society in all its various shapes and forms is going towards, particularly at those younger generations.
I think beauty is a spectrum. We dye our hair, we pluck our eyebrows, we use mascara, a little bit of blusher, some, makeup, concealer, lipstick, etc. Aesthetics is obviously that next level where we are penetrating through the skin. I see it as a medical procedure. And with that comes a sense of responsibility. Again, It comes down to duty of candor and supporting our patients to make the right decisions for them. I think it's also okay to say no if you are not in line with that. I think your vibe attracts your tribe.
Mm-hmm.
And my vibe is very clear that I personally, what I like to deliver in my clinic is natural looking aesthetics. So that means looking fresh, not fake, looking good, not done, radiance on the outside, wellness on the inside. You've come to my clinic, you've seen that on my wall. And what I call empowering transformations, really helping to boost their confidence. But at the same time, my husband's a psychiatrist. I've spent 5 years doing a psychological questionnaire assessment on patient motivation and also impact of treatments on patient psychological well-being. We have to, as clinicians, look at if patients are coming in with body dysmorphia. And we know that our industry will attract patients with body dysmorphia. And it's vital that we are comfortable in having these conversations. And if patients are asking for things that are actually not in their best interest or that may mean impacting their aesthetics, but actually negatively impacting them psychologically, physically, mentally, then our duty is actually to say no or to refer them for a psychological assessment before taking that step forward.
Absolutely.
I think that's very, very important. But I can imagine how divisive this conversation might be.
Absolutely. I mean, I think it's also a reflection of how the world is shifting as well, and different generations embrace it differently. Interestingly, when we presented these trends at IMCAS in Paris just last month, there was a very clear split between the age groups and how they responded. The much more seasoned, more mature, if I can say, press journalists were horrified by beauty fandom. The much younger ones who have grown up in a world or who are now living in a world that is very non-binary, that is much more expressive, who are much more fluid in how even they identify themselves.
Embraced it.
This is part of their dialect. This is not new news to them.
Yeah.
And I find that really eye-opening because we have to be really vigilant about who our society is as well. We can't get stuck in, I can't get stuck in looking at who the Tatler reader is or who the beauty triangle consumer is or who I am at 38 years old living in London. Yeah. I can't assume that everybody looks and thinks and feels like I do. I have to remember that we're part of a bigger society and that thinks in many different ways. Yeah. And I think that's something really interesting, but also difficult, I imagine, for you to balance as a practitioner, trying to be cognizant of that.
Well, yeah. And also as a human being, when you talk to me about these things of beauty fandom and I'm imagining these elf ears.
It's very Lord of the Rings style.
Exactly. But you know what I'm thinking of? I'm thinking of in certain parts of the world, like in Africa, what they do is in certain regions, the women go to a village dentist to have their teeth literally filed down or fractured down into little pinpoints. Mm-hmm. And each of their teeth are filed down to look that way because that is what is deemed socially acceptable, in their culture attractive. If they don't do it, they're less likely to get married. They're less likely to kind of go up the ranks of society. And for evolutionary purposes, they do it because that's what seems attractive in their society. Mm-hmm. In certain parts of the world, women put rings around their necks to elongate the neck.
Yep.
In other parts of the world, like in China, women have their feet crushed and then wrapped
the feet bound
to keep their feet small because that is deemed aesthetically acceptable and most attractive. And we in the West, I think, look at them and go, oh my God, look what they're doing. Mm-hmm. In a somewhat judgmental way and in a way where we think, that's terrible. That's an awful thing to do to women. And I wonder, how is this any different?
Yeah.
To what extent?
I totally
how do
agree.
we say, where do we draw the line and say, well, this is actually distortion, this is negatively impacting people?
I think when we can't identify with it, we get confused. And that's when we put up a barrier automatically and we say, this is wrong.
Yeah.
You only have to look back on Renaissance Tudor paintings of women and they all used to pluck their hairlines really far back to give them these incredibly high foreheads. And it was a very fashionable statement. They put lead on their faces to make themselves very pale. Again, with education, with hindsight, we think differently and that can cause judgment sometimes. But I think actually it's very, very difficult to put yourself in somebody else's shoes and understand their motivations behind doing these things.
Yeah.
And that's a huge part of any aesthetic consultation, I imagine, understanding someone's objectives.
Totally. So interesting. For me, I think it boils down to first do no harm. And if I feel I'm going to be doing a patient harm, like, as a dental surgeon, my former life, I cannot imagine chiseling someone's tooth down into little pegs, because I know that that's causing them harm, and I know that there's a trajectory, and I know that in 10 years time, they're probably going to lose their tooth. So having that scientific knowledge and understanding is actually, I am harming this patient. So for me, I would find that particularly difficult. But that's me here in the West.
Yep.
If I was there as a village dentist, and actually I knew that if this patient didn't have it,
they wouldn't get married. They wouldn't have a family.
Exactly.
They'd be sort of not embraced by their community. You have to make that judgment call. You have to weigh it up. But I think, look, first and foremost, your profession is medical, and you have an oath that you've sworn to do no harm. So I think that has to obviously be first and foremost.
So when you're writing about these trends, or when you're curating your content for example, the beauty guide, I'm sure you come across things that you think, oh my God, no, this is a trend that will die down, or I hope will die down. How do you kind of navigate that noise? Do you lean on the doctors to guide you?
Yeah, very much so. I think, at the end of the day, the doctor is the person who's going to be administering this treatment. We're very well known throughout the Tatler Surgery Guide sort of for always introducing readers, consumers to the best in the business when it comes to our publication. So yes, it's about leaning on the doctors. I think, look, these trends will come and go. You said this at the beginning, and I think it's important to have an awareness of them. You also said that just so that you can be open-minded, because you don't want to get stuck in a tunnel vision of only writing about one thing and failing to understand or even be aware of what your readers are looking for, because consumers, readers, they are somewhat fickle. They will be lured by different trends. Whatever's new and shiny will pique their interest all of a sudden. And so I think you can't ignore things, and it's important to allow them to inform you. Would we go out and then say, go and reshape your ears, go and have a Barbie nose? No, but I noticed even this year when I was editing the surgery guide and I was speaking to a rhinoplasty surgeon, and he spoke to me at great length about the importance of transgender patients and how he sees a lot. And actually, you'll know this as well, I'm sure, because you're obviously a non-surgical rhinoplasty specialist yourself. But he was saying, there's a huge amount involved, and it's an incredibly rewarding case to do. But in terms of building up a feminine nose to make it more masculine, taking a masculine nose, sort of feminizing it by making it sort of more petite, sort of more delicate somewhat. But it was the first time that I'd heard a plastic surgeon, a cosmetic surgeon, speak at such length about their work with transgender patients. And I thought, wow, this is really a tipping point.
Yes, it is.
And I wonder if years to come, that conversation will be more dominant again. Yeah. Another note on that, when we were in Paris and we were presenting these trends, and I mentioned the expressionality one that came out. And that was fascinating also in a similar vein, because we really drilled down, and this is, again, going full circle back to what we were saying about understanding the importance psychologically of words, but we really drilled down into what words such as, and I just said them myself, masculinization and feminization even mean to the patient nowadays. What do they identify with? Are we using these words too flippantly? Not everybody wants to identify with having a masculine or a feminine face. Maybe they don't identify with either. Maybe they identify with both. So I think there's this real emphasis on just, I guess, awareness and really respecting sort of what individuality means to patients nowadays.
Especially now with non-binary and this fluidity, it's important to hear your patient and deliver very bespoke, highly personalized service. So when my patients come in, it's not up to me to say, I think this is what's going to look right on you. Yeah. The conversation is, what are your goals? What is it that you want to achieve? And then there's a conversation about how we work towards that. But respecting individual differences is absolutely important. And I think that's actually quite a healthy conversation to have, because we've moved away from this cookie cutter approach, which I feel was around 5 years ago. We were going to these conferences and nobody was talking about the psychology of aesthetics. It was very much codes and
absolutely,
you know,
it was very granular and ratios and
yes.
these many points exactly in these positions. And
everyone needs high cheekbones and a tapered chin and big lips. Well, actually, no.
And I'm sure you must have even noticed it, but I know when Profilo first launched in the UK, for example, and everybody was like, it's these 5 precise points each side of the face. It's been developed by a facial plastic surgeon. This is what we do. It's safe, whatnot. And now when I have Profilo, I don't think anybody does those same 5 points on me. Everybody has become very creative. They're all artists. Look, and at the end of the day, everybody has an incredible understanding of the anatomical, structures that exist beneath the skin. So they're still doing it in a safe way. Yeah. But I think we've moved away from these points and these ratios and these codes somewhat. And we've said, but hang on, not everybody's face is the same. Yeah. And why would I put a point there when you're prone to puffiness under your eyes? That's only going to exacerbate the issue.
Exactly. Absolutely, 100%. It is artistry, right? And that's where our creativity comes in. I think to do this, you've got to be an artist, really.
Do you find yourself doing the same? Are you much more led now by the face that sits in front of you
always.
rather than a 9-point technique or a beauty code, an MD code?
I remember the first time I was mentioned in a magazine about 9 years ago. It was for the 8-point lift.
Yes, exactly.
And I was like, oh, this is wonderful. And I was doing a lot of 8-point lifts, which is essentially where we place filler in 8 strategic points in the face along the cheekbones and the nasolabial folds to kind of blend the jowls and lift the
and it's all been sort of anatomically sort of approved as being sound.
Yeah, and it is sound. It is, to be fair, it is sound. But then we alter that according to the patient. Yeah. Again, I remember going to a conference many years ago and this phenomenal Brazilian plastic surgeon being on stage, and he had these 20-year-olds that were all stunning on stage, and he was talking about their facial features and what he was going to do to them. And this was at the time where the trend was, high cheekbones, tapered chin. And there was a stunning Brazilian girl that was there, young lady, who had a relatively squarish chin. Her beauty, she was stunning. She had a very structured face. And he said, she looks like she could take care of herself. We're going to change that. We're going to give her a tapered chin. And I just remember going,
oh my goodness.
And looking around me horrified and thinking, is anyone else horrified by this? Because I saw that to be dangerous. And I thought, no, this is where we go into this cookie cutter approach, trying to create clones of each other. And we're completely removing individuality. And I innately disagree with that.
Oh, 100%. And it's when you have these sort of conversations with people and everyone says celebrities are all starting to look the same. Yeah. And
we've seen that.
Yeah, we absolutely have.
Yeah. And thankfully we're seeing the opposite. We're seeing a shift. And it is celebrity driven. That's why we have to know what's going on. When Kim Kardashian and Kylie Jenner had her lips and openly talks about having her lips, boom, everybody was coming in for their lips. Yeah. But I couldn't carry on my face Angelina Jolie lips. It wouldn't suit me. Yeah, exactly. So that's where artistry comes into it. And that's where ensuring that the patient looks good, not done, comes into it for me.
But it's also about, our evolution and understanding of these products, of these techniques. And there's constant, incredible R&D going on in, the background. And, you're involved with a lot of these companies and amazing products. And so you'll know even more about this than I do. But I think with greater education comes greater awareness of how to create a better result. I mean, the last time I've been having dermal filler in my face for a number of years and always in my cheekbones and temples. And in fact, the last time I went in, I had it back in my hairline because it's a trend that I think a lot of aesthetic practitioners are now doing, because we've all suddenly realized that there's only so much volume we want to be adding. Yeah. We've always spoken about treating the periphery of the face, not the central parts now, because that is deemed old hat. Yeah. And we want that natural aesthetic. But how interesting, it's now moved from the cheekbone, the temple, out into the hair itself, into the skull. Yeah. And that to me sort of I found really interesting when I had the treatment done. I was like, look at how our knowledge is it's changing month on month,
it's
year
evolving.
on year. Absolutely.
That's science, right? Medicine, especially aesthetic medicine, it is undergoing changes every single day. 24 hours, something new will come out. That's great. That's wonderful. But also we've got to ensure that there is robust scientific evidence behind it. And I always say to my patients, look, what I'm doing today, I always think, how is this going to age in 10 years' time? But I'm also aware that things will change. Yep. So what was right 10 years ago might not be right today. And what might be right today might not be right in 10 years' time. Yep. We've got to be aware of that and be comfortable talking and acknowledging that. And I think that's a good thing. I mean, now we're talking about exosomes and regenerative medicine and fillers in the hairline to create a lift. And we know that we can actually create lateral lift and recruit the local tissues, which is amazing. And we now know what we didn't know 2 years ago, which is fillers last a lot longer than we once thought. We thought fillers would last 12 months, 18 months, 24 months at best. We now know filler can last 10, 20, even 30 years.
Yeah, absolutely.
So with scientific evolution, we will continue to learn more and more, and then alter our treatments and utilize our tools in even more innovative ways.
Yeah.
I want to hear more about the trends that really stood out for you and where you think aesthetics will go in the next 5 years.
I think the one that we haven't spoken about, you very, very fleetingly just touched on it then, is that of the biohacking, the longevity, the cancelling age, so to speak. Although cancelling age is different. Cancelling age is very much about not being defined by your chronological age.
Yeah.
So it could be somebody much younger who is embracing a much more mature aesthetic and vice versa. But I think the whole conversation surrounding longevity, rejuvenation, and taking a really proactive stance when it comes to these therapies that are designed to reboot us, repair us, use the body's own natural resources to anti-age us naturally, even though I think anti-aging is not really a sort of word to use nowadays. But
what is the word to use?
I don't know. I think anything, in all honesty, that's connected with age is not the word to use, because I genuinely don't think people identify with it. And actually, we had this conversation at IMCAS, and there was a bit of a debate. You know, there was another journalist with me saying, past a certain age, everyone wants to be anti-age. She was like, you know, everyone's lying if they say they don't want to look, you know, 10, 15 years younger. But for a certain cohort of patients, it's not about age. It's about looking like themselves, but when they're happy, when they're rested, when they're full of energy and life and vitality, versus, you know, completely on the floor, exhausted because you've been running around after your entire family and your dog and your business for however long.
The husband comes somewhere else.
Yeah, exactly. Further down the list than you, most likely. But yeah, I think this sudden sort of laser vision, I suppose, on the future potential of what we could be doing. I mean, you mentioned exosomes, for example. I think we're still sort of getting to grips with exosomes as a product, as a treatment, exactly the best source to be using, how to use them. I think we've still got a little way to go. You know, obviously there's been a huge explosion in polynucleotides. That's been a massive thing. And I think it's exciting. It's a new development and something that, you know, I've used sort of polynucleotides under my eyes. Are you using them in your clinic?
Yes, I'm a trainer. I'm a key opinion leader for Dermafocus, which is polynucleotides.
And getting great results, I imagine.
Absolutely. I mean, I absolutely love them. I think you're right. I'm going to touch on something that I heard from Alice Hart Davis. And she says, I hate when people say you look good for your age. Just say you look good. And it's really interesting to hear how that might be perceived and taken from someone that you say, you know, I have patients who come in who are 50, 60, 70, and I go, I used to say, you look amazing for your age. And now I'm like, don't say that. Yeah. That might be perceived as offensive.
That's interesting.
And there's a really, you know, now we know that actually chronological age and biological age are two separate things. You can't change how many years you've been alive or how many years you've been on earth, but you can change your biological age. You can change how quickly you're aging. You can actually reverse aging. So, you know, in theory, we can live for a lot longer, but the idea now is not just that we live longer, but that our quality of life for the years that we're on earth is good. So I don't want to live until 80, but have debilitating psychological, mental, cognitive decline or physical decline and really not enjoy the last 10 years of my life. I want to live healthily with vitality for as long as I possibly can. And that's the concept of biological aging, is how do we biohack your genes so that you are optimized, you're living in an optimized health state for as long as possible. And we now know that we can. Now, there is a whole host of regenerative medicine, and regenerative medicine has been around for a long, long time. And in aesthetics, we're kind of adopting it, and we have been adopting it more and more so over the last 5 years. Polynucleotides is just one. I've done a whole podcast on polynucleotides. Polynucleotides actually have been around for 75 years in medicine and in aesthetics for 50 years.
Haven't a lot of these aesthetic things. I mean, they're all born out of a sort of medical rehabilitative world at some point.
I'm waiting for the leeches, because leeches have been used in medicine for a long time. I am sure we're going to come out with leech mucin or something. Leech facial. I am sure it will happen at some point.
See you at your clinic next week.
When I talk to my patients about, you know, polynucleotides come from fish sperm, they're like, huh? So it is pretty shocking. How did someone take a little bit of fish sperm and inject it?
Absolutely.
How did they realize? But we know actually that it works really, really well. It works well for stimulating fibroblasts, for regenerating the tissues head to toe. We use it in the hair for hair regeneration for patients who are losing hair. Around the eyes, we're very limited before on what we could use. We can't use Profilo in the eyes. We can't use Radiesse. We can't use Sculptra. We can use polynucleotides. And actually, I had my filler, my eyes dissolved, and instead had polynucleotides. I've had 3 sessions, and I'll keep going with it.
Yeah, I absolutely will as well. I've never been a good candidate for tear trough filler because I am too prone to water retention under that area, and I would run a mile from any practitioner who tried to do it to me. But polynucleotides without the hyaluronic acid to avoid that sort of attraction of water, absolutely beautiful.
Yeah. And I think this space will continue to grow. I think regeneration is the future. I think we're going to see this really becoming at the forefront of everything that we do over the next, I'd say, few years until the next best thing. Because, Radiesse has been around for a really long time. Radiesse is a calcium hydroxyapatite filler that is a filler. It's a volumizer, but we also know it will stimulate collagen, and now is being used either hyperdiluted or diluted with hyaluronic acid to stimulate collagen. Then there's Sculptra, which is a polylactic acid, which is also made by Galderma. That has been around for 25 years and has been reformulated, and that stimulates collagen. And the whole idea, I always hear, I come from a background also of surgery, maxillofacial surgery. I feel like sometimes there's a war between surgeons and non-surgeons. Surgeons going, none of this, don't do this stuff, and it's bad for you if you want to have a facelift in future. And I hear that, I acknowledge that. Yes, if you've had Sculptra relatively recently and you're going to have a facelift, it might make that facelift more difficult, and we have to be cognizant of that. And therefore have the conversation with the patient. Do you want to have a facelift? Are you planning on having a facelift?
Absolutely.
If so, maybe don't have your Sculptra. But most of the patients who are tapping into the non-surgical sector are those who never want to have a facelift or want to delay a facelift for as long as possible. And we've got to respect that and give them the right options.
But I think to your point as well, sort of just there, sorry to interrupt, but
no, it's fine.
I think it's really interesting, this sort of dichotomy between, do you do the non-surgical and is that going to negatively impact your ability to have the surgical? But you just said it there. It's actually really important just to have that conversation, just to say to your patient, what are your plans for the future? And also to create a bit of a support network for them as well. So you shouldn't be working with the patient in isolation saying, I'm doing all of your non-surgical. Off you go, see Mr. Such and Such for your surgery, and that's the end of the line here. I think that the best results come from when all of those practitioners and that patient are all on the same table. And actually, I think that's where it comes down to collaboration.
Exactly.
And you understanding where your skills begin and end, where a surgeon might pick up, or where anyone else might pick up, where a psychologist might pick up, where a manual lymphatic drainage expert might pick up. And you almost being that bridge for the patient sometimes and passing them over to the next pair of safe hands for them so that you're still involved in their journey. And no person in the medical industry should see themselves as an island. They're just operating in that way. There's so much to be gained by working together collaboratively.
You know what? I'm so glad you have said this, because I think this is so important. And I see it's so sad. I find it so sad because ultimately, who is it impacting? It's negatively impacting the patients.
Yeah, absolutely. And it's confusing them as well.
Yeah.
Because they're thinking, I've got to go to X, Y, and Z, and it's so confusing, and I'm here and I'm there. And
it's continuity of patient care.
Yeah.
It's actually what we've been taught from day one of medical and dental schools, continuity of patient care. Somehow, what I have seen, and I'm very much about collaboration, I will often pick up the phone to a colleague and say, look, I'm looking after this patient. This is what I think they need. It's not within my scope of practice. Can I refer them?
Yeah,
and they take on that journey, and we remain in conversation because it's continuity of patient care.
Yep.
And it means that patient is really leaning in on a multitude of experts, and they're getting this multidisciplinary care to ultimately give them the best possible results. And when there becomes this blocking off and practitioners wanting to work as islands and in isolation, maybe from, I don't know, scarcity mindset a little bit, perhaps a little bit of a competitive mindset. Unfortunately, that negatively impacts them and their patients.
I 100% agree.
So I'm really glad you've said this, because that is very much my mindset. I'm always talking to other colleagues. I offer lymphatic drainage massage. I speak to surgeons coming from a surgical background. I see both points of view. And I think ultimately that patient may tap into surgery at some point. Yeah. And that's absolutely fine. We have to empower them on that journey, but we have to respect where they are. Not everyone can afford a facelift. Not everybody wants a facelift. I personally have seen many facelifts go wrong. I have seen patients come to me post facelift. So I have got my expertise, my experience, my mindset, my thoughts. I am not saying no to having a facelift in the future, but I do want to delay it as much as possible for myself.
Absolutely. And I think it's good to recognize that. I think the other thing that's interesting in our domain in the UK versus maybe other territories is how specialist everybody is becoming as well. People have really started in aesthetics, whether it's surgical, non-surgical, to pick a path now. And I noticed this from my work at Tatler, from what I do at the Beauty Triangle. There are surgeons who know how to do every procedure, but in later years, they all go down the facelift route, or people who just go, actually, no, it's all about noses. I'm just going to focus on noses. People who just do non-surgical noses, people who just do amazing filler, and that's all they want to do. And I think it's very different to other territories. If you go to the US, for example, and you say to a surgeon, what's your specialism? They'll say, I do everything. I do faces, I do breasts, I do tummies, I do some lipo, I'm doing a nose this afternoon. And
butt lift in the afternoon.
Yeah, exactly. and it's and that's how they approach, they try to be all things for their patients. And, you know, maybe it's sort of their business model over there. I think it's a very different attitude towards surgery. Obviously, they're lacking that stigma that I think we still sadly do attach to it in the UK. But I've certainly noticed that throughout the years of working within this industry, that everybody is becoming a super specialist. But we have to be careful with the super specialisms that we don't become too narrow-minded. Absolutely. That we stay connected to the other people. Being a super specialist is fine, as long as you're still relying on other super specialists to support you and support your patients.
Yeah. I'm gonna talk about that a little bit, because I think actually what that takes my mind to is this concept of treating the patient holistically as a person, not as a feature.
Yeah.
And
I love that, not as a feature.
Yeah.
You're not a nose.
You're not a nose. You know, patients come to me and I do a lot of noses. My days are filled with noses. My years have been filled with noses. I love nose. I actually genuinely love transforming and treating noses. There is such
it's the most powerful change for a patient, I sometimes think.
But because of the psychological burden.
Because it is the most psychological point on the entire face, I think.
They come in and they say to me, they don't just go, I want to look younger. It's not about youth.
It's not about that.
It's not about rejuvenation. It's actually a structural deficit.
It's fundamentally changing the shape of their nose.
Yeah. And they have often say to me, I hate it. And that's a very powerful word to associate with something on your face. They've been bullied about it. Friends, family, school, colleagues have said negative comments that have lasted and impacted them to the point where they won't wear their hair up. When they're driving, they might stop their car a little bit so that the person next to them in the car
so it doesn't see them in profile.
Yeah. They won't sit next to someone, when they're having dinner, will always be face to face. These are the little things that impact them psychosocially every single day. So when I'm treating that, I'm actually treating the whole person and the psychological burden. That's what I'm taking away, not just the bump on their nose. So it's a really, really empowering, uplifting, life-changing treatment for patients. But they're not a walking, talking nose. They're a whole person. And I have to assess their face holistically. I have to assess them holistically. That's why I say you cannot treat body without understanding mind, nor can you understand mind or treat mind without understanding body. And we've got to take this holistic understanding of the patient that walks through our door, that they're not a pair of lips, but actually what's their motivation, why. That's why I did the psychological study. That's why I'm so interested in this kind of field. Because I have seen the hyper-specialism. And remember, as dentists and dental surgeons, you become hyper-specialized from day dot, right? And yes, you have a holistic view, but you are really specialized in one area. And then I went off to do surgery and I started to understand this a little bit more. And then I became a patient myself and started to understand it more. And also understood how negatively that narrow-minded viewpoint or treating a set of symptoms or features can have on patients' well-being. Yeah. If you are just treating the source, the symptom, the pain, the issue, the feature, without understanding the patient holistically, you are most likely not going to create the transformation that you want to inside out.
It's the difference between treating the symptom and the root cause, like any doctor would be aspiring to do.
Totally. And I think that's really, really important, of taking this kind of almost like this bird's eye view of the patient. And if it's not within your scope of practice, being really honest about that and saying, look, I think there's a few other things going on. I'm going to refer you to X, Y, Z person to do a blood test, to do this. So we can look after you in a multidisciplinary way. And that's what I used to do in hospital. That was, in hospitals, when I was doing maxillofacial surgery, we would have multidisciplinary team meetings every single week about every single patient.
And it's the way it should be. Yeah. I mean, when we launched the Beauty Triangle, that was always our guiding objective, that we always had holistic conversations. So, I mean, you've attended our festival, you've been at our events, we always have 3 speakers on a panel for the consumers to engage with and ask questions with and learn from and be educated by. And it's because there is not one single treatment that is right. Just as you would say, I'm sure as an aesthetic practitioner, No one treatment works in isolation. It's about combining things. It's about layering things. It's about working globally, holistically, all these words that we might use. And it's the same in the way that we get our education. There's no point us doing a talk and only having an injector on the panel or only having a dentist or only having a Reiki healer. But you put all of those people together and the conversation that comes out of them is
magical.
Absolutely fascinating. And what's really interesting is to see every time we do a talk and, they might be completely disparate. I think the last talk we did, we had a dermatologist, a hair transplant surgeon and a breast surgeon. But all of them had this common thread, which was, the importance of understanding the individual, understanding the psychology of the individual. And actually what you realize is that we're all talking about the same thing at the end of the day. If you're in your job medically for the right reasons, I think you are all doing it for the right reasons and you're all having the same objective, which is to look after the patient, make them feel happier, empower them, educate them to some degree. And so I think actually that is really the future. And it's not seeing aesthetics as an isolated subject and just saying, you've got your wellness and your fitness and your nutrition and all of that. And now we're going to talk about injectables. It's like injectables needs to be part of the conversation. We've just spoke about how important they are for skin health, for mental health, for, preserving anatomical structure in the years to come. So why are we trying to sort of stigmatize compartmentalize it, keep it in the shadows? Jigsaw. It has to be made a part of the bigger conversation. Wellness is huge. Wellness is booming.
Totally.
But aesthetics needs to be a part of that.
Yeah, I think it's a piece of the puzzle, isn't it? And treatment options and repertoire that we can give to our patients. And actually, one of the things that when I was doing my research, one of the things that I did was a menopause research. And we were asking patients, we surveyed 2,000 patients from the age of 16 to 64, because there are some patients who go through premature menopause at 16, 17, 18. I have a few patients that have gone through it, and it's a very difficult thing to go through. But the number one kind of threads that ran through all of them was the pursuit of confidence. And that's the reality, is our patients are coming to us because they want to feel confident and they want to feel healthy and they want to feel well.
Yeah.
I want to ask you one last question before we round up. And I want to ask you about the beauty triangle, what the why is and what the future is for the beauty triangle. Because I know this is your own project, isn't it?
Yeah, exactly. So I established the beauty triangle because my specialisms were very much spa, wellness and aesthetics, cosmetic surgery. And like we've just sort of discussed, I think the two need to be seen together. Yeah. I don't think we should be compartmentalizing, isolating and making people feel that they have to subscribe to one box or the other. We have to be living in this much more 360-degree world and having conversations that are much more holistic and well-rounded. I think I also wanted to do it because having written about cosmetic surgery and aesthetics for so many years, I know better than anyone the barriers that exist for people when it comes to pursuing treatments like this and the fear factor that goes into it, whether that's who's going to judge them, what it's going to be like when they get into a clinic, fear of an unnatural result. That's the biggest deterrent from anyone having an aesthetic procedure. Safety profile, there are a lot of scandals. We only see examples of bad work in the public domain versus the good ones.
Yeah, bad news makes news.
Absolutely, exactly as you said. But they also often say the best facelift or the best filler is sat across from you on the tube and you don't even notice because it's been so beautifully done.
Yes.
That's why I always point out all the work. I point out that, I've had toxin, I've had filler and I've done this and I've done that because I think it's really important that we actually own these decisions and we're empowered by them rather than feeling we have to hide things away. So I think the beauty triangle was born out of that. It was born out of this desire to open up the conversation, empower people to have these conversations and not to feel like it's something that they have to be ashamed of or feel vain for doing or hide from people. But also to acknowledge the power of working collaboratively, involving different specialists, relying on different people, really building your support network. And ultimately having a community. Human connection is so massively important. And, we were lucky that we started the beauty triangle, I think it was 1 year, maybe 18 months before we went into lockdown. So we had a little bit of a sort of build up to doing in-person events and it went brilliantly from day one. Then we went into lockdown and it was like, what do? You're missing that power of human connection. Yeah. We also started doing podcasts. We turned all of our existing content into podcasts so people could continue to engage with it.
Well done.
We started doing webinars. I mean, we had to jump on the Zoom bandwagon. It was terrifying. I hate technology. I I'm terrible at it.
But so good at it.
Everything became a webinar for, probably 9 months to a year, maybe more. We started doing events as soon as we were able to. When the world slowly started to reopen, we started hosting them outdoors. We said, sometimes they were rained off, sometimes we were lucky and it was sunny and we were able to still communicate with people. But I think the thread that has been running through everything we do is that human connection, bringing people together, having these conversations. And I think the Beauty Triangle Festival that we hosted in January, it was our biggest event yet. It was 250 people. Amazing. It was a full day, amazing speakers. We had some incredible beauty and wellness journalists hosting the conversations. It was the first time that I took a step back and didn't actually moderate the conversation. I opened up that conversation, I suppose, to other incredible journalists who had their own perspective and point of view and audiences and life experiences. And it was really powerful and really empowering to see conversations exist in different communities and different circles and really bring it to life for people. So I think the future is really exciting. It's really bright. It's more large scale events. It's more immersive events. I think we're also stimulated by experience. Yeah. We want to try things, test things. Yeah. I loved it at the festival. I walked around and I would see people sort of reclining on lounges and they had LED masks on. They had their sort of noise cancelling headphones so that they could hear the talks on the main stage. Then they went off and they did some pelvic floor tightening and then they had a consultation with yourself for facial filler. And then they were sort of buzzing around doing all these different things. And I think that's what I want to show consumers, readers, patients, people who don't know anything about our industry. I want to show them how exciting and how diverse and how much potential is in our industry and how transformative it can be when you genuinely have a partnership with the right practitioner and you find your blueprint, What
a great word, partnership. Exactly.
It's what it's about.
Well done to you, because really you've grown this so much over the last couple of years, and being at that stage where you can take a step back and oversee it all happening and walk around and
it's like the first
really nice
baby.
It's like
you've had the baby and now you're like, right, I'm going to get a nanny now. Someone else can know.
What's next for the Beauty Triangle?
We're building up the big scale events. We would like to do them. We'll continue to do them every year in London. We'd also like to do them more regionally. So you and I need to have a conversation about that.
Amazing. Yes,
which would be exciting, right?
I mean, do you know that Liverpool is the city for aesthetics?
I had heard. Yeah, exactly. Exactly. So I think Liverpool will be really exciting. Yeah. I'd love to go, further afield internationally as well. I just think as a concept, it is something that everyone needs. We all need to be educated. We all need to be empowered. Yeah. We need to understand the potential and the future, and we need proper information from proper practitioners as well.
Right.
People who
get into your
genuinely,
exactly.
Get on that massage team.
On the train back now, you're going to put your phone away and you start writing, pen to paper, old school way.
Oh my God. Actually, I just invested in a new notebook, which I haven't done for years. I used to swear by my Smythson little paper diary notebook as a journalist. Then obviously it went onto the phone. And this year I was like, no, I'm going to go back to paper.
Yeah, there's something magical
It's important, isn't it?
So last question before we say goodbye.
I think you said that 10 minutes ago.
I know, but I can't. This is an important one. If you could only have one tweakment, what would it be?
Filler. And I say this to everyone. When they say, what's the most transformative treatment you've had? I always say filler, because it is the one treatment I've had where I go into a clinic, I see my practitioner, I'm not feeling 100%. I look at the photographs that are taken. I see that things aren't anatomically in the right place anymore. I see the shifting of time. I see stress. I see exhaustion. I see all these things etched onto my face. And then I've had the filler, and wherever it's been positioned very beautifully, very strategically, very judiciously, I immediately notice the impact. And I don't think I look different. Yeah. I have been assured by many people, nope, your face still looks, you haven't sort of taken it too far, which is very important. But I look in the mirror 1 minute, 2 minutes later, and I'm like, there's me. I'm back again. I'm energized. I'm fresh. Yeah. I don't look exhausted. I can go out and face the world again. And I think that is the most addictive feeling. Addictive is maybe wrong. Maybe sounds like I'm hooked on it, which I'm not.
But it's that instant gratification.
It's an empowering feeling. Yeah. Absolutely. When you and I know that there are many incredible treatments out there, but they will say to you,
it's delayed.
You need 3 months to see the full effect. You need 18 months to see the full effect. This will work best if you have it in combination with X, Y, and Z. Not to say filler isn't beautiful in combination with other treatments, and it's certainly not the only thing I do. Yeah. But I think you hit the nail on the head when you said instant gratification. I think sadly the world that we exist in is very fast paced. We don't always have time. I don't always have 3 months to
wait for the result.
Absolutely.
Listen, I mean, also you said you hit the nail on the head when you said empowering, because yes, patients come in, they don't say I want to look like this. They say I want to look less tired. I want to look less angry.
I want to look like me
sad.
again. I want to look like me on a good day. I want to look like me after I haven't been up four times in the middle of the night with the baby and like sort of been up for various hours writing my surgery guide or planning my next beauty triangle first. Like, but that's the life that we all lead, and it's fine, and we can manage it. But sometimes we need a little bit of a helping hand, in partnership with a practitioner, using the right products, applying them beautifully to feel like the best version of ourselves again.
I love it. Francesca, thank you so much for coming on the Aesthetics and Wellness podcast. I could speak to you all day.
I know. I feel like we need to do a whole series. The Yusra and Francesca podcast.
Yeah. See, you're getting your creative mind. I like it.
I know. This is what coming to Liverpool does for me. It's awesome.
Right. Till next time. Thank you so much.
Thank you so much for having me. It's been amazing chatting.
Thank you. Likewise.